Hi, my name is Dr. Sunil Sharma, and today I'll be talking about sleeve gastrectomy. Sleeve is most commonly performed bariatric operation in the United States. And there are reasons why this operation has become so popular. The most important reason is its simplicity. Very technically, very simple to perform using a stapler. Takes about 30 to 45 minutes with quick recovery. The second advantage, I think, is there is not much alteration in the physiology. There is no rerouting of the intestines. The food and juice practically flows through the normal way, so it's very appealing to the patient. And third, it is effective, as effective as to many other bariatric operations performed. So what is done in sleeve gastrectomy? Essentially, in sleeve gastrectomy, you remove the excessive portion of the stomach. So you are reducing the size of the stomach. That's when patients eating small amount of food will feel full. And the second important reason is you remove the portion of the stomach which secretes hormones like ghrelin, leptin, which are called hunger hormones. And so after removing those hormones, patient tends to get better appetite control, feel less hungry, and that's the reason it works so well. How is it performed? Most of the surgeons, they perform this operation laparoscopy using tiny holes, putting the camera, instruments, looking at the monitor, and do the whole operation. It's a minimal invasive way of doing the surgery. Recently, people have started doing robotic. I've been doing robotic surgery, sleeve gastrectomy, for the last few years and found it very useful and has its own advantage in terms of better visualization, better handling of the tissues, less bleeding, less trauma to the patient, translating to quicker recovery and going home and early return to work, so on and so forth. How does sleeve gastrectomy works? Two reasons. One, you're reducing the capacity of the stomach, so less food is required to stretch the sleeve and to give the sensation of fullness. And two, since that portion of the stomach which secretes ghrelin and leptin is removed, you have a better control of appetite. It changes the hormones, it's a metabolic operation, and it helps in cure of diabetes and many other metabolic problems. So what's the real advantage of performing a sleeve gastrectomy? First, it's quick. Two, has less complications, particularly long-term complications. Three, it's more physiologic. You can eat practically normal food without altering too much anatomy. And four, it does show equally good results compared to other bariatric operation. So who's the candidate to undergo sleeve gastrectomy? Well, in order to decide that, we perform endoscopy before the surgery. The endoscopy is performed for many reasons. You want to make sure there is no ulcer, tumor, mass, infection in your food pipe, esophagus, or in your stomach. We do a biopsy to check if there is a H. pylori infection, and if there is a H. pylori infection, it can be easily treated with antibiotics. 2 weeks of antibiotics cures it. You don't want to operate on a patient who has infection. Number two, you want to look at the anatomy of the stomach. You visualize the hiatal hernia. If there is a hiatal hernia, you grade how severe it is and if they have symptoms to it. If patients who have a large hiatal hernia and that is not addressed and they get a sleeve gastrectomy, they will have a very bad reflux. You can perform sleeve on patients who have a large hiatal hernia, provided you fix the hiatal hernia first and then do the sleeve gastrectomy. Then we also look the content of the stomach. You want to make sure the bile is not refluxing back from intestines into the stomach, causing biliary gastritis. If that is the situation, then sleeve may not be the right operation. You may need some sort of operation which can do diversion, biliary diversion, like duodenal switch or a gastric bypass. So if there are no strict contraindications for sleeve gastrectomy, I think it's an ideal operation and have good long-term results. If you want to know more about the sleeve gastrectomy, please visit our website, sharmasurgery.com, or call our office, make an appointment to learn more about it. Thank you so much.